Not every red eye is conjunctivitis. Let's quickly learn how to tell the difference. If it's conjunctivitis, the redness is usually diffuse and generalized across the entire bulbar conjunctiva. Sometimes there could be watery, purulent, or stringy discharge depending on the cause. Other possible signs could be eyelid crusting or follicles on the conjunctiva. If it's anterior uveitis, the redness is always concentrated around the iris. And of course, your patient would complain of pain. Sometimes there could be increased tearing, but no mucus or pus. With your slit lamp, you could see cells and flares in the anterior chamber and sometimes keratic precipitates. In scleritis, the redness is usually deep and could be sectoral or diffuse. It usually involves the deep sclera. There is usually no discharge, and when you instill vasoconstrictors, the blood vessels will not blanch. And of course, there will be pain. For episcleritis, the redness could be isolated or could be in patches. The redness is always between the conjunctiva and the sclera. This doesn't involve the deep sclera. And when you instill vasoconstrictors like phenylephrine, the redness will blanch, meaning it will whiten. There will be mild discomfort, irritation or tenderness, and there is usually no significant discharge, but your patients may complain of mild watering. For subconjunctival hemorrhage, there is usually a bright red patch with a sharply defined border. This redness would usually not cross the limbus. There is no pain, but there could be a feeling of irritation or grittiness, and there will be no discharge. For angle closure glaucoma, the redness is usually engorged. This picture may really not do justice to what an angle closure glaucoma looks like. Patients usually complain of sudden severe eye pain, often with headache, nausea, and even vomiting. There could be tearing, but there will be no eye discharge. Other signs are mid-dilated and fixed pupil. Your patient's cornea might appear hazy. When you palpate the eyeball, it feels hard to touch. So next time you see a red eye, look closely. Each pattern tells a story. Follow iLearn Academy for more clinical tips.